in some ways don't work, these diets out there. Today's Healthy Living House Call is sponsored by Florida Hospital. Weight loss, man, it can be hard, especially hard for a certain group of people. If you've got a long way to go, it can seem like it's a road with no end in sight. No matter how hard you try, it's hard to get those results sometimes. Some people turn to weight loss surgery to get that answer. Is that the answer? Well, let's talk with Dr. Keith Kim, a bariatric surgeon with Florida Hospital. Dr. Kim, good to see you. We've been having a very interesting talk, and I'm fascinated by what you say is that sometimes it's just, no matter what you do, your body is predisposed to just be at a certain weight. Right. And will fight you to either go up or go down from that weight. Is that what you're saying?
Absolutely. Obesity for many people is a genetic disease. And what I mean by that is that their genetics dictates what the appropriate weight range is for them. And sometimes that's not a healthy weight range. And whether that's a healthy weight range or not, their body will do everything they can to keep the patient in that weight range. So, for example, somebody tries to move outside of this weight range by dieting and exercising. Yeah. Once they get to the lower limit of what the genetics dictate, their body will fight it by physiologically responding, for example, by slowing down their metabolism.
No kidding?
Yes.
It will work against you.
Absolutely.
It's like, get off that Stairmaster.
That's right.
Okay. Well, how is it then that you can get beyond that?
Well, so it's very difficult by dieting, exercising, even a lot of these popular weight loss programs and even medications, because they don't address what's happening, which is the body is responding physiologically. Okay. Surgery, on the other hand, though, affects biologic pathways, and it will affect things like their metabolism, their gut hormones, their insulin resistance. And so surgery triggers physiologic mechanisms that actually fights the body at the physiologic level, and it will help patients overcome that resistance to the weight loss and will help them lose the weight.
Surgery such as like getting your stomach stapled and things like that?
Well, so that's what it was classically known as, but gastric bypass, sleeve gastrectomy, the biliopancreatic diversion, these type of procedures which are recognized and approved as acceptable interventions for weight loss.
If we're predisposed to be a certain weight, wouldn't we have seen that kind of obesity rates before the advent of, like, say, fast food that came out in the 50s? We just skyrocketed once that happened.
No, that's a good question. And you know, take, for example, a population of people that have a certain genetic predisposition for melanoma. And one generation stays indoors because they recognize the risk, and then the next generation, for whatever reason, needs to be outdoors a lot. For example, they depend on agriculture. Now, you have the same genetic pool, but the incidence of melanoma is going to go up because of the increase in risk. But within that population, there's still going to be people that have no risk for melanoma from a genetic standpoint, even if they go outdoors that don't. And then there are going to be people with a high risk that even if they stay indoors will develop it. But there's a big pool of people that have variable risks that depend on their environment. And so, as you point out, the environment has changed and it's triggering these genetic predispositions to express themselves.
Well, Dr. Kim, because we were really just scratching the surface here, Dr. Kim is going to stick around, answer your viewer questions about bariatric surgery, weight loss programs. If you've got something you would like to ask Dr. Kim, just go to our website, fox35orlando.com/health, and then post your questions. You can find the links right there if you just go to our main page as well. We're going to check back in with Dr. Kim in just a little bit later on in the show, see what people have been asking, and you know, the kind of answers you've been given. It's a fascinating conversation. Nice to have you here.
Thank you.
Thanks for sticking around.